Hi, I'm Santosh, one of the co founders of Kino Health. We work on the problem of medication adherence for patients who take multiple medications. Typically, these patients have comorbidities, they're just post surgery or post discharge. Some of the reasons that we found that patients just don't take their medications on time is the list of medications is really large, the pill burden is really large. They're very expensive, they're hard to procure, they're not available locally, they have to really, they have a lot of side effects. A lot of patients genuinely tell us that they have trouble understanding the medications itself, like nobody's explained to them. And this leads to bad health outcomes. I can give you an example of a gynec patient whose medications have been switched 3 times in a month. These are hormone medications, and the results were disastrous. Partly because the patient didn't take the medications as prescribed, and partly because the physician, kept changing the regimens. A hip and knee replacement patient that we met, 60-year-old, total hip and knee replacement for both legs, had about 5 medications on an average for a month, for a period of 3 months duration. Could not remember the refill dates, could not talk about the names of the medications, or she never consulted a pharmacist. There is absolutely no guidance for her to take her medications as prescribed by the physicians. The surgeon itself is based of another state in Gujarat. She has to meet a local general practitioner to follow up. It turned bad really early. Our vision with this company is to focus on 4 therapy areas where medications are expensive and they're high risk. Oncology between cycles when they are in maintenance. Patients who are going through dialysis, that is nephrology. Patients who are going through hip and knee replacement, orthopedics, as well as patients in gynec segment. Our vision is to get this to as many patients as possible, scale this really fast, ensure that outside the control of the sphere of control of the physician, the patient is able to take care of themselves. At least they are able to name their medications, at least they're able to remember the refill dates, at least they're able to express their voice through outcome measures, as compared to some of the other stuff that's available, like pill boxes and trackers and so on. That's our grand vision, and Roshan will explain to you how we are going about this with our technology.
My name is Roshan. I'm the other co-founder at Kino Health. I'm going to give you a brief overview on technology aspects of our product and also how are we getting it in front of patients. Our flagship product is called Prodia. It is a web-based platform which is used to capture what we call the patient's voice. Patient's voice is nothing but data aggregated in the form of health outcomes data, in terms of their underlying symptoms, in terms of generic and disease-specific quality of life metrics, which is captured using assessments which are NIH and NHS validated, and we generate these results onto an analytics dashboard. In terms of how exactly are we getting it in front of patients, we enroll patients through providers in the form of programs for specific areas, and we have an in-house team of clinical pharmacists and tele-nurses who get in touch with the patient via phone, carry out these assessments, note down any concerns in terms of their medication, and we relay it back to the physician. So we relay the data back in the form of reports as of now, and we also have an auxiliary app which can be used by patients and caregivers to carry out assessments, view their results, get reminders, etc. So this is currently we are within the city of Bangalore in India, and with WaterBridge's help we would like to expand. Why are we enrolling into this program? The main reason is because WaterBridge, we've looked at their investments, we've looked at what you've done within healthcare, specifically with companies such as Pocket Pills, and we feel you would be an ideal partner during the formative years, where it's not just about the funding, it's about the right technology roadmap, it's about the right operational expertise in which we want to implement within our back-end processes to make it more efficient, to handle more patient volumes. and also expand our sources into Africa, which seems to be another second market for us because we have a great footprint in terms of our advisors there. So we would like to leverage this opportunity with WaterBridge. I would like to take this opportunity to thank you everyone for giving us this opportunity, and yep, look forward to connecting again soon. Have a great day and cheers.